The COVID-19 pandemic has caused a lot of global uncertainty for a lot of people. People are unsure when they'll see their relatives again. Job security's been rocked. There's an increased threat to people's health. Government guidance is changing, and there's been a lot of speculation as to the potential mental health toll of all of this uncertainty, particularly within the UK. It's been, a topic of conversation, and what our study wanted to look at was the ways that people have coped with this uncertainty of the current situation, and also look at the impact that this has had on their mental health. Nearly 40% of people reported levels of distress that were above clinical cutoff. So this indicates that these people were experiencing levels of distress that was really impacting them in their daily lives. We also found increased rates of depression, anxiety, and health anxiety in comparison to previous studies. It indicates that COVID-19 has likely had a direct impact on people's mental health. Obviously, future longitudinal research will tell us more about that, but it's starting to indicate the mental health toll that this pandemic might have had. The other things we found were that the rates of health anxiety were at least doubled in people with physical health conditions. So in people with physical health conditions, 24% reported clinical levels of health anxiety. And that might be because the threat of the virus is more significant for these people. So we know that people with pre-existing physical health conditions make up the majority of the people that die from COVID-19. So this could be why, but it kind of indicates to us a population that really need, that extra care and might need that additional mental health support during this time. Part of this research is acknowledging that there has been a mental health toll. It's okay not to be okay during this time. But, it helps us think about how best we can support those people who are struggling and what they can do to support themselves.